Alright, this video is going to go over the basic structure and function of the eye and 3 common disease processes and how to treat them. So first we start with the sclera, which is the white part of the eyeball, and it's made of a tough material that protects the eye. Then you have the choroid, which is where the vascular vessels are between the retina and the sclera. That's where the red blood vessels are. The cornea over here is the transparent dome that sits in front of the colored part of the eye. The cornea helps the eye focus as light makes its way through and gives you a clear window to look through. The iris, right here and up here, is the colorful part of the eye, and it has muscles that change its shape to control how much light goes through the pupil. Then the pupil is the black circle in the middle of the iris, which is an opening to let light enter the eye. Over here we have the anterior chamber, which is a space between the cornea and the iris filled with transparent fluid that nourishes the eye. Then the lens over here is behind the iris, and it's clear and helps focus light rays on the back of the eyeball. And this back part of the eyeball is called the retina, and it's sensitive to light. This is where the eye takes what it sees and sends nerve signals to the brain to understand what is being seen through the optic nerve over here. The ciliary muscles up here and down there hold up the lens and change its shape to focus, just like a camera lens focuses on things close or far away. And the vitreous humor over here is in this vitreous body. It has a clear jelly-like material that gives the eye volume and shape, so it makes it squishy. And the macula is a little part over here. It's usually like a circle, and that's where you have the sharpest vision. So first disease process that I picked is a cataract, and that's when the lens becomes opaque and cloudy and can happen in one or both eyes. Some symptoms of that are usually a decrease in vision, abnormal color perception, and glaring of vision. And the glare is usually worse at night when the pupil dilates. Diagnostic studies needed include history and physical exam, visual eye acuity measurement, ophthalmoscopy to see the opacity of the lens, like how clouded it is, or a slit lamp microscopic examination and glare testing. If the lens is completely opaque, the pupil appears white, and once diagnosed, the provider will go over care options, several of which can be done while waiting to choose surgery. Some conservative care options include new eyeglass prescription, reading glasses, magnifiers, and only driving during daylight hours to avoid the difficulty that the glare causes at night. And that's especially important to educate patients on. Surgical therapy is outpatient and includes a preoperative phase that involves administering non-steroidal anti-inflammatory eye drops to dilate the pupil. This can be done with a cycloplegic drug such as tropicamide that blocks the effect of acetylcholine on the iris sphincter muscle, so that way it can't contract during the surgery. Then intraoperative phase is where the cataract is extracted and an intraocular lens is implanted. After the procedure, antibiotics and corticosteroids may be given. It's important to educate the patient about wearing an eye patch or protective shield until their post-op visit, and proper adherence to eye drop therapy to avoid infection and decrease inflammation. And it's really important that patients are being compliant with those eye drops because that can really impact the outcome of their surgery. Nurses should educate the patient about the importance of limiting activities that increase eye pressure, such as bending, coughing, lifting, and ensure they understand how important their follow-up care visits are. Education about proper nutrition, vitamins, avoiding radiation, and wearing sunglasses is also part of that teaching. Another common eye disease is diabetic retinopathy. So that happens on that back layer of the eye, and which is caused by uncontrolled blood sugar that blocks the tiny blood vessels to the retina, which cause them to leak fluid and bleed. The eye compensates for the blocked vessels by growing new ones, but they don't function as well. The symptoms of diabetic neuropathy in the beginning may not be present, but slight vision changes may come and go. In later stages, blood vessels start to bleed into the vitreous humor, which can cause dark floating spots that look similar to cobwebs If treatment isn't performed, this can cause more bleeding, scarring, and blindness. This can lead to other serious eye conditions such as macular edema, neovascular glaucoma, and retinal detachment. The physician is going to test for this condition by performing a dilated eye exam with eye drops that widen the pupil. Treatment includes injections that can slow down the progression of or reverse diabetic neuropathy, such as diabetic retinopathy, such as anti-VEGF drugs and corticosteroids. Laser treatment is another option to shrink blood vessels, stop them from leaking, and decrease swelling in the eye. If it's very advanced surgery called a vitrectomy, where the vitreous fluid is all removed, the retina is repaired, and then the fluid is replaced with silicone oil, is another option. Health promotion for patients at risk of developing diabetic retinopathy revolves around education about controlling diabetes. This includes proper nutrition, exercise, monitoring blood glucose levels, and medication compliance. Teaching the patient to regularly get a comprehensive dilated eye exam at least once a year will help diagnose the disease early rather than too late. And lastly, another common eye disorder is age-related macular degeneration, known as AMD. This is where the macula, which is part of the retina, wears down. Dry AMD is the most common form, so that's what I'm going to focus on. And it can present with worsening vision, dark blurry areas called blind spots in the center of vision. It is diagnosed with acuity measurement, ophthalmoscopy, and the Amsler grid test. More specific testing can include fundus photography and IV angiography to find out the extent. And treatment is similar to diabetic retinopathy with laser treatment called photodynamic therapy and other eye injections. Health promotion of this condition includes educating the patient about the importance of vitamins in the prevention of AMD and the treatment of it. Smoking cessation education can also help stop the progression of it, and education about eyeglasses, driving during the daytime, and recognizing the need for eye exams is of high importance. And nurses should focus on helping patients focus on how to make the most of what they have left with their vision. This video was brought to you by these sources, and that's all.